All right, good morning. Today we're going to talk about what causes headaches, what causes all different kinds of headaches, from migraines to occipital neuralgia, tension headaches, and how to fix them. And so what I really want to first get across is old thinking versus new thinking. Now, classically, neurologists have felt that, and rightly so, there's been a lot of teaching over a long period of time about the physiology of headaches. And neurologists have felt that dilation of blood vessels in the brain is what causes the headaches. And now here you can see there's a study, a very good study from the Journal of Headache Pain in 2020. And it talks about a bunch of things, but it says currently this classical vascular theory naming vasodilation as the migraine pain generator seems less reliable compared to a theory focusing on central sensitization, where activation of neuronal receptors is pivotal to the origin of migraine pain. Now, what that means in English is that instead of vasodilation, which is the enlargement of the blood vessels in the brain, sensitization of neuronal receptors, that indicates that it's the sensory nerves in the head and neck that get irritated. And that is actually now thought of as what is causing migraine pain. And again, this is migraine pain, but it's also pain associated with all different kinds of headaches. This paper goes on to say the current paradigm is supported by evidence of hypothalamic activation and the view of vasodilation as an epiphenomenon. We'll go through this, but as an epiphenomenon rather than a causation of pain. The origin of the perceived pain most likely resides in the trigeminal ganglia and associated sensory fibers. Now, again, in English, epiphenomenon is indicating that the vasodilation happens along with the pain as opposed to causing the pain. But this is talking about the origin of the perceived pain is from the trigeminal ganglia and associated sensory fibers. And the trigeminal nerve is a sensory nerve that comes from the second and third cervical roots. Interestingly, so does the occipital nerves, and the occipital nerves and the trigeminal nerves are closely related. And what this paper is saying is that it's the sensory fibers of these nerves that are causing the headache pain. And so what we now know is that irritation of these sensory nerves in the front and the back of the head are what are the cause of headache pain. Now, how your brain interprets this pain is how you get your diagnosis. Now, some people will have these nerve compression issues, nerve irritation issues, and they cause, let's say, shooting pains in the back of the head. That gets diagnosed as occipital neuralgia. Other people have these sensory fibers in the front and in the back of the head that send these distress signals to the brain, and the brain interprets them differently and starts giving you photophobia, nausea, and pain, prodrums, all of the things associated with migraines. So, same origin, different diagnosis based on how a particular person interprets these distress signals from these nerves in the front and back of the head. Tension headaches, for example, are caused by muscle tension pushing on the nerves in the back, causing vague and very severe pain in a headache. Whereas occipital neuralgia has that same compression, but that causes kind of shooting pains or sometimes generalized pains. Honestly, the diagnosis is subjective from the discussion between the patient and the neurologist. So based on what the complaints are, that's how the neurologist is going to categorize the headache. But so many of these headaches, and not all of them, but so many of these headaches are caused by irritation of the nerves. Now let's get into that a little bit and talk about what we see in the nerves. Now, these are going to be some intraoperative photos, and these first photos are taken here from the back of the head and the occipital nerves. And here you can see there's a band of tissue that's pushing down on this woman's occipital nerve. And I've dissected out the nerve above and below the band, but you can see that this band of tissue is pushing on the nerve. That's going to cause severe irritation, and that's going to send distress signals to the brain. And how that brain is going to interpret it, well, it's going to be interpreted either as shooting pains or generalized headache, or potentially associated with all of the things that we do associate with migraines. Now here, the irritation is kind of relieved once I take that band of tissue away. And now you can see I've dissected the whole nerve free, and you can see it's laying in a much more relaxed fashion. You can actually see the red stripes. Those are blood vessels that now can provide nutrients to this nerve. And the nerve it's healthier. It's not going to be irritated. And so those distress signals no longer get sent to the brain, and there's no more headache. Okay, this patient got complete relief from her headache, as about 40% of our patients get 100% complete relief from headaches, and this patient was one of them. So now this can happen both in the back of the head as well as in the front of the head. There are several different nerves that can trigger these headache syndromes. And this is the occipital nerve, which is in the back of the head. Now, these next photos are going to be shown. They are coming from right here. Above the eye, you have your globe, which is your eyeball, and that sits in your orbit, which is your eye socket. And then above your orbit, these nerves come out to give you feeling to the front of your scalp. The occipital nerves give you feeling in the back of your scalp. The supraorbital and supratrochlear nerves give you feeling to the front of your scalp, and they can be entrapped in a lot of different ways too. Now, this next patient here, she had a tight band of tissue that crossed the nerve and compressed it. And you can see here, the tip of my scissors are behind this band of tissue. You can kind of see the nerve, but it's hard to see in this picture, so I didn't even point it out. But what we see is when we release that band and then actually dissect the nerve out through the muscles, and these are the muscles that cause the frowning, like the 11s that people treat with Botox. Those muscles also can push on the nerve, which is why Botox can help headache pain. Botox relaxes the muscles, and if it's the muscle that's pushing on the nerve, when you relax the muscles, the headaches get better. Now, if it's that tight band of tissue instead of the muscles that's causing the nerve irritation, well, then in that case, even if you relax the muscles, your headache pain's not going to get better, because that's not the thing that's causing the compression. And really, the only thing that's going to fix the compression is this nerve decompression outpatient surgery that we do. But here you can see that once I take that band of tissue away and dissect this nerve out through these muscles, you can see all of these branches that are going up into the forehead, and they're going to provide sensation to the forehead, just like the occipital nerve provides sensation to the back. And then there's a couple nerves over here that we can talk about another time, but that provide some sensation to the temple. They can also cause headaches. And so there's about 7 nerves on each side. There are 7 nerves on each side of the head and neck that provide sensation to the scalp. And when they are compressed, they cause headache pain. And so what we do is we decompress them, and we create a better lie for a lot of those nerves, so they are not irritated. They're not sending distress signals to the brain. They are not sending any of these signals that then get interpreted as migraine or a new daily persistent headache. All of these headache syndromes can and are often caused by this irritation of these sensory nerves. So my job is to fix those headaches, and by decompressing those nerves, we get patients to find relief. And again, about 40% of patients, they never have another headache. About 50% of patients, they still have headaches, but they're like normal people headaches where they can take Tylenol, or some of them even can take a triptan that never worked in the past and now works great. But they can medicate, usually with over-the-counter medications, once, and their pain goes away and they can live their lives. So that's our goal, is to get you back on your feet and get rid of your headaches as a means of causing you significant discomfort and debility. So that's really what I wanted to get across here. If you have any questions, you can learn more about what we do at headachesurgery.com. You can call the office and make an appointment, and I'd be happy to discuss your particular situation with you. And I hope that provided you with some good education. Again, I'm Dr. Adam Lowenstein. I'm a board-certified plastic surgeon who specializes in migraine surgery, and I'm specialize in nerve decompression for migraines, occipital neuralgia, and all different kinds of headache pain. All right, take care.